Hello, my name is Dr. Raj Mukherjee. I'm a neurosurgery attending at Johns Hopkins. I focus primarily on neurosurgical oncology, which means that I treat brain tumors of various types. And that includes metastatic brain tumors, gliomas like glioblastoma, and various skull-based lesions like pituitary tumors, chordomas, chondrosarcomas, and craniopharyngiomas. The reason I got into and interested in neurosurgery was really it was a personal decision. So there were several family members who had brain tumors, head bleeds, hydrocephalus, and over the course of many years, and particularly during my medical training, I was really introduced to neurosurgery, really not of my own volition, but the impact that those neurosurgeons and their judgment and decision-making had on my family was really quite impactful. And it was because of that inspiration, because of that impact that they had, that I really wanted to make my contribution to medicine through the field of neurosurgery. I also had really great mentors, including here at Johns Hopkins, particularly in the field of brain tumors. Brain tumors have been particularly troublesome to treat over the past 100 years or so. Really, the field of neurosurgical oncology started here at Johns Hopkins with Harvey Cushing, who is known as the father of American neurosurgery. And really that tradition of innovation and excellence in patient safety and care is what drew me back to come here to Hopkins. It's an honor to be here. It's an honor to treat the patients that are here, that come not just from Maryland and Baltimore, but from really all over the country and the world. I treat patients both at Johns Hopkins Hospital and at Johns Hopkins Bayview Medical Center, both in the city of Baltimore. My research interest really does focus on neurosurgical oncology, and in particular it focuses on trying to optimize patient outcomes, patient safety, and quality. And the way that manifests particularly is trying to develop and validate new quality of life metrics so that really we focus on what the patient's needs are and their wants of surgery, not really necessarily what the surgeon wants, but what's of value to the patient, to their family, as well as designing some innovative clinical trials, patient registries, and analyzing really what they call big data for neurosurgical outcomes. My goal is to treat every patient genuinely like I would my own family member. I think given my history, my family history, and our interaction with neurosurgery, I know how difficult some of the decision-making process is. And so I really take it to heart, knowing that the decisions that we're going to make together really can change a person's life and a family's dynamic. So I take my responsibility really seriously. I think I've been trained really well over the past decade and more. And every day I come to work genuinely trying to do what's best for patients and what's best for families. It's a real honor and privilege to interact with patients at these really critical moments in life. And genuinely, it's my honor and pleasure to be here and to help you however I can.